talk about biopsies, prostate cancer, the role of pathologists in healthcare, and we have a great guest, someone who is extremely well known in the field of pathology. My good friend, Dr. Michael Misalek, is online with us as Associate Chair of Pathology in Newton Wellesley Hospital, and he's also Associate Professor of Pathology at Tufts University. Believe me, he knows what he's doing, and he's extremely experienced. Clinical pathology at University of Massachusetts Medical Center, and he's also a very active member in the College of American Pathologists. Michael, good morning. Dr. Samadi here.
Good morning, Dr. Samadi. How are you? Thank you so much for giving me the opportunity to be online this morning. It's a wonderful thing that you do each and every week, educating the public about healthcare, prevention of disease, staying healthy. And I wanted to bring this morning the hidden gem of medicine, really medicine's secret weapon, the pathologist, who you know very well. Most doctors do, but we'd like to introduce ourselves to the public. And what better way through education about prostate cancer? I know that's near and dear to your heart, and certainly to mine as well.
Well, if for people out there who have questions about prostate cancer or pathologists, or you were just diagnosed with prostate cancer and you don't know what it means, you're looking at your pathology report or you may not even have it, please call 877-970-2999 in the next half an hour, and Dr. Misalek is going to answer your questions. We're also going to post everything on Facebook and Twitter. Michael, people have elevated PSAs. They go to the doctor, and the doctor says you have prostate cancer, and they give them something called Gleason score. Just in a short period, what does Gleason score mean? What's the classification, and what does it really mean as far as aggressiveness of cancer?
Right, exactly. So perhaps the most important thing to know if you do have a prostate cancer after your PSA number is your Gleason score, as you mentioned. And Gleason is a grading system that pathologists use to assess the characteristics of the tumor that we see under the microscope and come up with a score. Gleason grade goes from 1 through 5. The higher the number, the more aggressive the tumor appears. And we take those two major
So it would
components,
be 2 to 10.
Right, and add them up and get 2 through 10. And Gleason is probably the bedrock. It has the most literature behind it as far as predicting outcomes of prostate cancer, of predicting disease in the prostate after surgery, and outcomes. It dictates therapy. It really is the first step into the system. And I think all men, if they have a question about their pathology report, should first request it. It's your right to see a report.